Most people talk about building an MVP as if it's just a smaller version of a big product, less features, less screens, less effort. But in real life, and especially in healthcare, an MVP is not about doing less. It's about being responsible from day one. My name is Anastasia. I work as a product architect with founders and teams when ideas stop being exciting and start carrying real responsibility. I'm usually brought in not to make products faster, but to make sure they don't break reality, technically, ethically, or structurally. That's why I'm very careful when we talk about MVPs in sensitive domains like healthcare. This project started with one very simple question. How do we turn daily patient behavior into something a doctor can actually trust? Not dashboards for investors, not AI for pitch decks, but real signals from real people, inside real constraints. At first, the system looks straightforward. Patients log daily actions, doctors review progress, admins see the big picture. Simple. But very quickly, one thing became clear. The main challenge wasn't the interface, and it wasn't even automation. The real challenge was data integrity across roles. Patients interact emotionally, sometimes inconsistently. Doctors think in patterns, thresholds, trends over time. Administrators need aggregation without exposing personal data. If you design this wrong, you don't get a rough MVP. You get a dangerous product. So the first decision was architectural. We separated the system into layers intentionally. The patient layer stayed extremely minimal. Yes or no actions. Simple numeric sliders for pain, fatigue, motivation, optional photo uploads, no complex flows, no heavy screens, low friction by default. Because if patients don't log, everything else collapses. The doctor layer was designed around interpretation, not raw data, not hundreds of records, but compliance percentages, trends over time, missed patterns, visual signals. Doctors don't need more data, they need clarity, and that clarity must come fast. Then came the analytics layer, the part most MVPs skip. Instead of querying live patient data every time, we created a separate aggregated data environment. Only anonymized, processed metrics live there. This protects performance, it protects privacy, and it allows analytics to scale independently. This single decision saved weeks of future refactoring. Automation became the backbone of the system. Every patient action triggers logging. Every missed task updates compliance metrics. Patterns are recalculated continuously. No manual syncing. No Excel exports to fix later. If something requires manual correction, it's not an MVP. It's a prototype pretending to be one. AI was added last, and very carefully. Not as a decision maker, not as a medical authority. AI here does one thing only. It summarizes behavior patterns into short, human-readable insights. Progress signals, missed adherence, risk flags, nothing more. In healthcare, boundaries matter more than ambition. And what we ended up with was not a flashy product, it was a working system. A patient app people can actually use every day. A doctor dashboard that saves time instead of adding noise. An analytics layer that shows patterns without exposing identities. And an automation pipeline that doesn't break under load. The biggest lesson from this build is simple. A real MVP is not built by asking, what can we add quickly? It's built by asking, what must never be wrong? In this case, data, trust, and clarity. Everything else is optional. If you're a founder building in complex, sensitive domains, healthcare, education, finance, this distinction matters. Because a product that only looks finished will fail quietly, but a product that respects reality gets a chance to survive.